Okay, we're here with Maggie, who had an endoscopic sleeve gastroplasty. So we're going to ask her a few questions and see how she's doing. So, how long ago did you have the procedure?
I had it in July of 2016.
So that would be
8 months.
Okay, right about 8 months. Okay, looking back at the day of surgery, how much discomfort did you have with the procedure itself?
Most of my discomfort was in my throat. My throat was really, really sore for just a couple of days. I had a little bit of pain right in the center, but it wasn't anything like totally unbearable.
So on a scale of 1 to 10 with pain, the worst pain you've ever experienced being a 10 and no
Probably
pain?
the first day was about a 7.
Okay.
Then after that, it went down real quick.
Okay. So how soon did you go back to work?
I had surgery on Monday, and I went back to work on Thursday.
Okay. All right. Could you have gone back to work on Wednesday if you wanted to?
Probably.
All right. Very good. Okay. And you didn't have any medical problems related to your weight before you had the procedure, which is not always the case.
Yeah, I didn't.
Okay. So afterwards, did the procedure lead to any symptoms or anything untoward afterwards? No. Okay. Okay. How much weight have you lost since you had the procedure done?
I've lost 43 pounds.
Okay. So that would be, I think, 87% of your extra body weight?
Yeah.
So compared to a surgery patient, a gastric sleeve surgery patient, that would put you in the high end of the weight loss curve for that group. So at least in your case, very comparable to a surgical procedure. How would you say your life is different now than it was before you had the procedure?
I feel better about myself. I definitely have more energy.
Okay. All right. I see you frequently because
Yeah.
you work with the organization we work with, and you just seem to be a little happier and smiling and a little more outgoing. Do you think that's the case? Do you think?
Yeah, I'm definitely happier.
Okay. Very good. You said your energy level's better. What do you mean by that specifically?
I exercise. Well, I walk every single day, about 4 to 5 miles every day.
Okay.
I try to do it in the morning. If I don't do it in the morning, I do it in the evening.
Okay.
So that's super helpful. So that kind of keeps me going.
How about keeping up with your family and your
Yeah, I do all of that.
other activities?
Yeah.
Okay. Very good. Do you measure how far you walk?
I do.
Do you count your steps?
I don't count my steps, but we have an iWatch
Okay.
that we keep track of the mileage.
Okay. Who's we?
Me and my husband.
Okay, so he goes with you?
Yeah.
All right. Has he had any benefit from you doing this?
Yes, he has actually.
Has he has he lost some weight because you're doing you're being more active or eating differently?
Mm-hmm. He has lost 15 pounds.
That's awesome.
Yeah.
So that's known as a halo effect, and that's been described with the surgical procedures. It's interesting to see it happening with the endoscopic procedure.
Yeah.
Okay, can you describe how you eat, how you go about eating now?
I still follow the low carb diet. I try not to eat carbs hardly at all. And I do eat a lot of protein.
Okay. What about portion size?
I usually eat about 4 to 5 ounces of food at a time.
Okay, so compared to before, what percentage or what fraction of what you were eating before at a meal would you say that is?
I could eat a lot more than I did before.
Okay, so like half or a quarter of what you were eating before, or less than that?
Probably about a quarter.
Okay. How often are you eating?
I eat 3 meals a day,
Okay.
and I try not to snack very much in between. Every now and then I might have something, if it's a protein bar or something like that in between if I get hungry, but I don't always have to have that in the middle of the day. I drink a lot of water.
Okay. So the feeling of hunger, is that changed since before the procedure?
I've noticed the longer out I am, I get hungrier a little bit more than I did before. Before I didn't get hungry hardly at all. Now I get hungry kind of like a normal person would get hungry.
Okay. Okay, so you already described what you do to stay active. Would you say it's easier to exercise now than it was before you had the procedure?
For sure. I definitely feel that way. Just getting some weight off, it's easier to move around and do things.
Right. So, there's a concept sometimes that you either do medical weight loss and change your diet and exercise more, or you have a procedure to take care of the weight. But in reality, they all kind of help each other out. So would you say that the procedure has given you more control and made it easier to do the right things or the things you think you would need to do to maintain your weight loss?
Yes, definitely.
is there any downside to doing the endoscopic sleeve gastrectomy that you can think of?
I can't think of anything.
Okay. All right. And on a scale of 1 to 10, for somebody else who's in a similar position to where you were before surgery, on that scale, how much would you recommend having the endoscopic procedure?
On about a 10, because I would definitely recommend it.
Okay, excellent. All right. So yeah, the only unknowns really are the longevity. It's obvious that the longevity is better than a temporary volume replacement procedure, but we just don't know for the long run. There is some 2-year data though that shows that the weight loss is pretty well maintained, so we're pretty hopeful that that might continue on well past that. So.
Okay.
All right. Anything you want to ask me?
No?
All right. Very good.